Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Wednesday, September 17th. Today, we're starting with a look at Sutter Health, which is rolling out conversational AI on a massive scale. We'll also explore a new academic health center taking shape in Florida, the latest moves in a fast-growing digital health consortium, and Amazon's billion-dollar investment to lower employee healthcare costs. And later in the program, Peerbridge Health CEO Chris Darland joins us to share how his company is tackling cardiac diagnostics in a whole new way. Let's dive in. We begin with a health system that's taking artificial intelligence system-wide. Logan Stokes has the story.
Sutter Health is rolling out conversational AI agents across its entire footprint, serving 3.5 million patients and handling more than 13 million visits a year. Built with HITshow, the agents will manage scheduling, refills, and billing requests. Leaders say the goal is to reduce long on-hold times, ease staff burnout, and give patients a faster way to get what they need. What makes this stand out is the scale. While most health systems are piloting AI tools in limited areas, Sutter is going all in across the enterprise. That move positions Sutter as a proving ground for whether AI can actually boost efficiency and patient satisfaction in a large, complex system.
Logan, do we have any sense of what this could mean for staffing?
That's the big question, RHONDA. Sutter says the intent isn't to cut jobs, it's to redeploy staff to higher value tasks. But industry watchers know that if AI saves significant dollars, other systems may see it as an opening to reduce headcount. So we'll be keeping an eye on this for any ripple effects it may cause.
Thanks, Logan. A bold step that could set the tone for how AI gets adopted across healthcare. Next, a partnership that could reshape care and education in North Florida. Nate Collier reports.
Florida State University and Tallahassee Memorial Healthcare are moving ahead with plans for a new academic health center. The partnership, approved unanimously by TMH board this week, is designed to elevate Tallahassee Memorial into a quaternary care hub while expanding FSU's research and training capacity. For the community, it means more specialty services close to home. For students, it creates advanced pathways in medical education. And for the region, leaders see it as an economic engine, generating jobs and drawing new investment. FSU President Richard McCullough and TMH CEO Mark O'Brien called it a historic opportunity to shape the long-term future of healthcare in North Florida and beyond.
Nate, this sounds ambitious. What are the next steps?
Right now, it's still a framework. Definitive agreements are being drafted, but both sides say the momentum is there. If finalized, this would put Tallahassee on the map not just for community care, but as a true teaching and research hub.
Thanks, Nate. Coming up after the break, we'll sit down with Peerbridge CEO Chris Darland to hear how his company is advancing affordable cardiac diagnostics. Still ahead, HITshow Ventures adds new health system partners to its innovation consortium, and Amazon makes a billion-dollar bet on lowering employee healthcare costs.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
You're listening to HITshow. Welcome back. Yesterday we told you about WellSpan's new partnership with General Catalyst's HatCo. Today we're seeing another example of how health systems are linking up with outside investors to drive innovation. Anika Shah has the details.
That's right, RHONDA. Health systems are increasingly turning to venture-style collaborations to co-develop and scale technology. HITshow Ventures is expanding its digital health consortium by bringing in 3 new members: Yale New Haven, Keck of USC, and Hartford HealthCare. That brings the group to 14 health systems, alongside names like Northwell, UPMC, Stanford, and Vanderbilt. Together, they pool resources and share risk to create startups that can be deployed across multiple markets. This fall, the consortium plans to launch 2 new companies focused on AI-powered health tech solutions. Leaders say this year is about proving the model with tangible results before ramping up more aggressively in 2026.
Anika, what's the real upside for these systems? Why commit so heavily?
The upside is leverage. A single health system can only pilot so much innovation, but by joining forces, they can test at scale and invest together. It's also a hedge. They're not just buyers of digital tools, they're co-creators with a stake in the success.
Thanks, Anika. Another signal that provider venture partnerships are becoming a serious force in shaping healthcare's future. Now to employers making moves on healthcare costs. Jade Romero reports.
Amazon is investing $1 billion to reduce employee healthcare costs. Starting next year, premiums for its basic health plan will fall from about $7 a week to $5, and primary care copays will drop to $5. The changes will affect hundreds of thousands of employees, particularly warehouse and logistics workers. Amazon already spends billions annually on healthcare, and this move signals just how critical benefits have become in the battle to attract and retain staff.
Jade, is this about taking care of workers or just keeping them from walking out the door?
Honestly, it's both. For workers living paycheck to paycheck, those savings matter. But from Amazon's perspective, benefits are part of a bigger retention strategy. Rivals like Walmart and Target will be watching closely to see if they need to match.
Thanks, Jade. Another reminder that healthcare benefits aren't just a cost, they're a competitive lever in today's labor market. To close today's show, PeerBridge Health has raised $7 million, filed for FDA clearance of its core MDX cardiac monitoring device, and expanded its leadership team. To talk about what comes next, here's Jalen Cross with PeerBridge CEO Chris Darland.
Chris, give us the quick origin story on PeerBridge.
PeerBridge Health was founded about 10 years ago by a pulmonologist at Northwell Health, a brilliant pulmonologist named Angelo Acquista. And even though he had spent a lot of his life in the hospital, had an experience with his dad in the hospital with him, covered in cords, walking through a hospital room, kind of led him down this path. There's got to be a better way.
Today, 4 out of 5 heart failure cases are still first diagnosed in the ER. What gap are you trying to close?
Heart disease is growing in the U.S. And hasn't slowed down. But the only place to really diagnose and find the disease is in the hospital, and it needs a cardiologist, and we have a massive shortage of cardiologists. Well, my family in the middle of Kentucky, as an example, that are out of reach of the health system today. 4 out of 5 heart failure cases are going to get found in the ER, and that's my family, effectively.
And you've just closed a $7 million round and filed Core MDX for FDA 510K. How does that advance your vision?
Having this device, being able to send this to him wear it for 5 minutes. We have a cardiac panel. We know exactly what he's doing, which then allows him in some future state to jump on the phone with a virtual cardiology practice and care for him without him leaving his house.
You've also added Dan Ruvers to the board and expanded your sales team. Who benefits most?
It isn't limited to just rural communities, which of course is my background, but urban communities where people are in hourly jobs where you can't just get up and go see a cardiologist. It's our goal, it's PeerBridge's goal, and the industry's goal should be reaching those patients where they are, not waiting for them to show up to us.
So at the end of the day, is this really about shifting from reactive to proactive heart care?
So the paradigm shift we're trying to push now is, can I get a device to my dad, to that patient, proactively, and for $25 find out everything I need to know from a cardiac perspective. And we shift from a reactive state to a proactive state, and everyone benefits.
That was PeerBridge CEO Chris Darland with our own Jalen Cross, a clear example of how startups are pushing diagnostics closer to the point of care. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.